Hello, everybody. That's Vincenzo Piccolo from Dermatology Unit of University of Campania, Luigi Vanvitelli. And after some videos about COVID-associated disease, I'm coming back to dermoscopy. And in particular, I collected for you a few news about pediatric dermoscopy. I want to start from these two papers from California that try to collect what is known about dermoscopy pediatric dermatology. These two papers talk about melanocytic and non-melanocytic growths such as vascular tumors or infectious and inflammatory disorders. The aim of my presentation is to present you 7 news about pediatric dermatoscopy. Let's start from number 1. This is a congenital nail matrix nevus in a 4-year-old guy. We know that in these patients, it's very hard to trust dermatoscopy, as dermoscopy usually looks like melanoma of the nail unit. What was thought about this nail proliferation was now confirmed, has now been confirmed by this very important study from International Dermoscopy Society. On more than 200 patients, it was demonstrated that the most common finding at onychoscopy in congenital nevi and congenital-like nail matrix nevi, i.e. nevi appearing in the first 5 years of life, the most common dermoscopic findings is the irregular pattern. So we know that congenital nail matrix nevi most often display dermatoscopic features that resemble what we see in melanoma. In the remaining patients, we can see a regular pattern, homogeneous pattern, and an exclusively periungual pattern. Another very important data emerging from this study is that 1/3 of the cases of congenital nevi of the nail matrix present with this distal fibrillar pattern that is called brush-like pattern, and it is very useful to look for it because we can have a confirmation of the diagnosis, as it is not usually seen in melanoma. More is needed to know about this very important topic, and the International Dermoscopy Society invites everyone to submit new cases for having new information about evolution of this very strange nevi. News number 2 also concerns nails. It is a very important paper about a new finding in tuberous sclerosis in children seen at nails. This finding was called subungual red comets by these Italian authors. And the red comets are seen at onychoscopy like these hairpin vessels with a tail in the proximal part that are well seen here at dermoscopy. So we have another skin sign that we can look for in tuberous sclerosis, along with achromic nevi, angiofibroma, fibrous plaques of the face, chagrin patch, and periungual fibroma. News number 3, again with nail, is very important, and it comes from Japan. It was demonstrated in this very important paper that a lot of patients with Kawasaki disease, that is a very important and severe disease of of children present with nail findings. And in particular, the most common finding seen in this patient is this orange-brown chromonychia discoloration that is seen in the early or late phase of the disease. The same findings were confirmed also by previous paper, like this one that found chromonychia in 70% of patients. So another very important dermoscopic news. Fourth, what is that? We have a patient, a child, with these white papules of the abdomen. What we see at dermoscopy is this white clots associated with these comedo-like openings. This is a very common finding in a complex disease, the rare extragenital localization of lichen sclerosus. In this paper, the ink test was associated with dermatoscopy, and it was demonstrated that the application of dermatoscopy with ink test may help the clinicians to look for comedo-like openings that sometimes in children are not well seen at dermatoscopy. Number five regards the sebaceous nevus. In this Italian paper from Florence, it was shown that a new finding can be seen at dermatoscopy of sebaceous nevus that usually presents with yellow dots. These new findings has been described as NFIT sign. And if you look at the first paper about dermatoscopy of adnexal tumors, including also sebaceous nevus, you can see the same finding here. And it's a transient finding because it usually develops to the classical findings of yellow dots. Number six concerns a newly described disorder. What is that? This is the face of the burrowing bug, a new insect responsible of a novel arthropod dermatosis, firstly described by Indian authors. This bug provokes a transient pigmentation of the skin, and novel cases of this condition have been described in literature. Recently, a lot of papers concerning dermatoscopy of this very unusual skin reaction have been published, and this is the most recent one concerning the so-called transient pseudolentigen sign. You see lesions resembling lentigens or melanoma in some cases, but they disappear in a few days or in a few weeks. The last news comes from my experience. I'm going to show you 3 cases that apparently don't have anything in common with each other, but if we take a look at dermoscopy, we will see the same finding. The first one, the second patients, and the third patients. What we see that they have in common is not vessels, it's not dotted vessels, but it's exogenous red pigmentation that was self-applied by the patients. This is the proof of the self-application, and with the alcohol test, I removed the pigmentation self-induced by the patients, and this is unfortunately one of the consequences that we had, a psychological consequence that we had from COVID restrictions in Italy and worldwide. Thanks for listening. Bye.